Jeremy Bradford, if I could ask of you. So you have a lot of seasoned experience in your leadership at the hospital level, and you serve now as the CEO for Good Samaritan. Do you think solving some of the physician shortage or the services behind it has to do with a change in the outpatient or inpatient care levels? Can you speak to that a little bit?
Sure. I think the key for any community is access. And that's one thing that I think we've got to really kind of take a step back and look at the different avenues that are available to us as far as taking advantage of those opportunities. One thing that we have really focused on in our area that has afforded us an opportunity over the past 4 years to increase our presence of providers in our rural market is the J1 visa waiver program. And with that, we've had a lot of support, and it's afforded us an opportunity to really fill the gaps that we've identified in our market. One touched on earlier, which is key, and we talk about that often, is primary care. When we look at the number of providers that we have on our team here present today, they wouldn't be sitting before you today, a lot of them, if it wasn't for the J1 visa program. And for us, it's really important that we continue to have that support from our leaders, but also to recognize the importance as we continue to look at the care gaps that we're trying to fill, and that's telemedicine. Telemedicine is something that I feel like that we all should be mindful of and continue to work towards the reimbursement models as well as the collaborative efforts that are going forth and moving forth with regard to the rural market. And that's one thing that I think it's important for all of us when we leave here today to realize that there are situations where it doesn't make sense for us to take providers into certain rural markets. However, it doesn't mean that we can't take the telemedicine component and complement and ensure that those communities are being served and that the patients are getting access that they truly deserve.
Thank you, Mr. Bradford. I think that's very salient what you shared, both telemedicine and the J1 visa.